I'm Frank Avalos, and today we're going to talk about compression. I remember the days where the Cochrane Review told us that the gold standard was to apply a 4-layer compression, but many years later, a statement was changed to some compression is better than no compression. Now, let's talk about, first of all, making sure that we do no harm. So when we're applying compression, contraindications may include arterial insufficiency, Raynaud's, CHF infections, smaller limbs, plus much more. So make sure you review that with your patients. But now we're going to look at over the different categories that we have. In addition to that, we also had Dr. Robert Goldman in our show, and he was actually showing us this little nifty device that measures the amount of pressure underneath compression, and it sends it to our phone. So now we're able to learn how much compression we're applying. So let's talk about the different levels. You have garments, which, by the way, they come in different sizes, different compression, also different materials. And you have to be careful because there's some compression that the materials will not give you the right amount of compression. Then, of course, you have the Velcro devices, and they can cover the whole leg, the whole arm. Talking about arms, they make compression for the arm, also for the chest, the torso. They make multi-layer compression, which we have different devices. We have tubular socks. We also have different kind of netting. And also one area that we forget about is the fingers. And so we, as lymphedema therapists, use a little roll to provide compression. And this is what it looks like, whether we're trying to compress the hand and fingers or the toes. And so if your clinic is not wrapping fingers or toes, you may want to get with a lymphedema therapist because they're experts on that. And then lastly, we'll also use short stretch bandages. And so ideally, when a patient comes to a lymphedema therapist, we want to use these short stretch bandages to reduce the leg and then fit them in a garment. And so make sure that you're not fitting them with a garment first, because then you're not utilizing those resources appropriately. And what I want to show you is calf pump is very important. So you're going to watch a video of using this little device on me, where I applied a 20 millimeter compression device, and I was just pumping my ankle.
As it comes towards you, he's waving at you. Lift him up to see what you can see as he begins his focusing here.
Make sure you appropriately compress your patients. Reach out to a lymphedema therapist or an expert and make sure that you get the right education for that.